My name is Jane Albertson. I'm a school teacher at Doernbecher Children's Hospital with the Hospital School Program, and I've been here for 2 years. This is my 3rd year. So the Doernbecher Hospital School Program is, like it sounds, it's a hospital school program, and we're funded through Multnomah Education Service District. We're part of their hospital program. So at our hospital school program here at Doernbecher, we service 3 different units: the 9th floor, which is the acute care unit; the 10th floor, which is the intermediate care on 10 North; and then on 10 South, the HEMONC unit. And so how our program works is that we're here to provide school services for students while they're in the hospital. We work closely with students' home schools to make sure that when they return to school after they've had a hospital stay, that that transition goes as smoothly as possible. So if that means we need to set up like a 504 plan or work on a health plan for the student when they transition, then we help facilitate that process. The second kind of part of our job is to just work with students on the work that they're missing when they're here in the hospital. So the students that we serve, like I mentioned, they're the 9th floor, which is the acute care unit, 10 North intermediate care, and 10 South HEMONC. And so how we kind of decide which students we see, because unfortunately, because of our staffing, we can't see every school age student in the entire Doernbecher Hospital. But we triage students based on their conditions, so chronic illness, or on their length of stay, so if they've missed like 5 or more school days. And we service students that are ages 5, so kindergarten, up to 21. Students that are on an individualized education plan or an IEP plan are entitled to services through the age of 21. And so typically, like I said, we triage those students. However, if we get a referral from like a social worker or a medical staff, we will see those students as well. Sometimes that's a student that's receiving services over at the main OHSU hospital. We will see students up in the outpatient clinic, so that's kind of the breadth of students that we reach. So partners are a big component. Collaboration, that's a major point of success for our program. Our program partners within the hospital. We work very closely with the medical team, so that's the doctors, the nurses, the specialists, as well as the child life team and the social work team. Oftentimes, we can't do our job really without them. We need them for telling us about what accommodations students might need when they transition back to school and signing those papers that the school needs a doctor's signature on. We also work really closely with the social work team, so that's if we get a referral or if we find out that one of our students hasn't been able to return to school after a stay in the hospital, then we can work and figure out what's going on there. Outside of the hospital, probably one of our most important partners is the student's home district. So on the floor I work, which is the 9th floor, the average length of stay for a student is maybe 5 to 10 days. So we really want to make sure that when they transition back to school, it goes as smoothly as possible. So we work very closely with the student's home school to get any work sent that they've missed, or to set up a plan that will help that student succeed when they return to their home community. So I feel so grateful to be in this position. I started here actually at OHSU working as a room service associate. So I was working there, I want to say it was about 2011 to 2013, and the populations I served were 10 South, which is the HEMONC floor, 10 North, the intermediate care, and then the 8th floor, which is the PICU. And so after I stopped working here, I really loved being at Doernbecher and wanted to continue to serve patients that were here at Doernbecher. And so I sought out volunteer services. When I talked to the volunteer team, I mentioned that I was back in school receiving my Master's of Education, and they told me that there was a hospital school program at Doernbecher. So they linked me with one of the school teachers in the program, Carrie Russell, and I was able to volunteer with her for about a little under a year. And then once I had to part ways because my academics and work schedule got a little too rigorous and too demanding, Carrie kept me in her contacts and notified me when MESD was hiring, and it just so happened that they were hiring when I right when I graduated my program, and so I got hired on, and this is my 3rd year with the hospital school program. Almost every day I get to work with a student. It feels like a success story, but I do have a student in mind that I was able to work with her during her sophomore year, and due to her diagnosis, she was out of school for most of her sophomore year, so we were able to use kind of a combination of her school district's work, as well as MESD has the Odyssey Wear program for us to enroll students in. So we were able to enroll her in some Odyssey Wear classes, and being able to work with her on those courses, she didn't get behind on any of her credits despite having not actually been to school during that sophomore year. And so I just got a phone call from her family saying that she's ready to start junior year without being credit deficient, and feels kind of ready and like it's going to be a very successful start. So that was just such a privilege for me to be able to work with such a strong student and just such a fighter. And so kind of all the props go to the student. I was there kind of helping with the instruction, but she really made it happen, and that just really reminded me of why I'm here and what I do here. So it's very special.